Hello, everyone. My name is Beth Kramer, and I am an adult gerontology clinical nurse specialist, and I live in St. Louis, Missouri. I'm enrolled in the Postmasters to DNP program, pursuing the general DNP degree. My SPP involves a quality improvement project aimed at deconditioning prevention and enhanced mobility in older hospitalized adults. The problem identification and practice gap is well described in the literature. From a global perspective, the World Health Organization recognizes the importance of patient mobility for continued health and well-being. It provides mobility guidelines and inpatient protocols and emphasizes the need for healthcare professionals to encourage patients to move and engage in physical activity as soon as possible after illness, stabilization, or surgery to prevent further complications. They cite mobility's benefits as multifactorial, including improved cardiac circulation, reducing the risk of DVTs, prevention of muscle atrophy and weakness, enhanced lung expansion, prevention of respiratory and cardiac complications, and improved psychological well-being through interaction with the environment. The World Health Organization believes mobility is multidisciplinary in its approach, involving collaboration among the multidisciplinary healthcare team, patients, and caregivers. Despite the World Health Organization's recognition of mobility's importance, the literature synthesis shows that older patients in acute care settings experience low mobility, leading to adverse outcomes such as disability, prolonged hospital stays, higher readmission rates, and increased healthcare expenditures. According to Kasani in 2023, patients spend 83 to 95% of their entire hospital stay in bed, and this contributes to hospital-acquired deconditioning and significant weakness. There are three populations that are affected the most. The first being older adults due to their pre-existing conditions. Secondly are the post-surgical patients. And lastly, those within ICU who are often sedated or mechanically ventilated. The Johns Hopkins evidence-based practice model was chosen because it aligns with the approach used at the academic center where the mobility project will be implemented. The evidence-based model's collaborative and dynamic team process ensures that solid outcomes are based on evidence through analyzing, synthesizing, reasoning, collaboration, creativity, and reflection. The conceptual model for this project is based on Albert Bandera's social cognitive theory, specifically focusing on self-efficacy. This theory emphasizes that learning occurs within social contents driven by a dynamic relationship between an individual's characteristics, behavior, and environment. Motivation theory plays a key role by asserting that individuals are motivated to act based on personal goals, self-efficacy, beliefs, and expected outcomes. The Johns Hopkins Patient Mobilization Attitude and Belief Survey will serve as the primary instrument for assessing nursing barriers and facilitators related to patient mobility. This instrument will be modified to focus on nursing knowledge, attitudes, and barriers to mobility rather than assessing the entire multidisciplinary team. The instrument consists of 26 Likert questions across 3 domains, 4 items addressing knowledge, 9 items covering attitudes, and 13 items exploring behaviors. Additionally, the instrument will be modified to include supplemental questions related to participant characteristics and 2 qualitative data questions. Pre-intervention chart audits and EPIC mobility reports will be utilized to establish current baseline mobility practices. Based on the initial survey analysis, educational content will be developed to address gaps in nurses' knowledge, attitudes, and behaviors. Mobility education will then be provided to the nurses on the designated unit. Johns Hopkins survey will be administered post-intervention alongside the EPIC mobility reports, and chart audits to assess changes in nurses' mobility, knowledge, attitudes, and behaviors. This will help determine whether mobility practices have improved with the goal of reducing hospital-acquired deconditioning and evaluating the overall impact of the education intervention. In closing, I'm looking forward to engaging with all of you over the next 16 weeks as we dive into and conquer this course together. Thank you.